Hello from Home Solutions. I'm here to talk to you today because your discharge planner or physician's office has contacted us to coordinate your home infusion therapy. I would like to talk with you about what infusion at home entails and the company I represent. First, Home Solutions is a large multi-state home infusion pharmacy caring for patients for over 20 years. Our founder believed in a philosophy and business culture of treating patients like family, and that concept is alive and well today at Home Solutions. Our nurses, pharmacists, and dietitians are dedicated to providing expert care to help patients just like you meet their home infusion therapy goals. We have dedicated and knowledgeable staff members such as nurse liaisons and account managers that provide teaching while you are still in the hospital. I would like to walk you through the process and expectations that you may have while preparing to begin IV therapy at home. The process begins with your current care team, usually a discharge planner, contacting our local pharmacy and sharing your insurance information and discharge plan. Next, our intake or admission coordinators and billing specialists will contact your insurance company to verify your enrollment, your home infusion benefits, and estimated out-of-pocket expenses based on your specific insurance benefits, and get a pre-authorization when necessary. A representative from our local branch office will contact you to review your insurance policy's home infusion coverage and the estimated deductible, co-insurance, or other out-of-pocket expenses you may be responsible to pay for in your home infusion services. Our admissions coordinators will also verify where your services will be given and how best to contact you from time to time. They will also ask you if there is anyone else with whom we need to communicate in order to coordinate your care. Your medical history and current therapies received from the hospital are reviewed by our clinical team, including our pharmacists, pharmacy technicians, nurses, and dietitians. We review items like your medication list, allergies, and height and weight to ensure your therapies will be successful at home. We individualize your plan of care based on the information we gather and for the best outcome. At this time, we begin coordinating the things that will take place in your home, mainly your delivery and nursing visit. Delivery personnel will deliver your medication and supplies based on the therapy prescribed for you. But the provisions vary depending on therapy, medication stability, and overall plan. We will coordinate the date on which you should expect the delivery to your home. Along with your delivery, there will be paperwork that you or your designated representative will need to review and sign. The nurse assigned to provide your services will either be one of our infusion nurses or a nurse from a home health agency in your community. This is dependent on your insurance coverage. Once you have received your supplies, completed your paperwork, and a nurse has been assigned to you, you will meet with your nurse for the simple but important training that you will need prior to receiving your first dose at home. During this visit, the nurse will teach you, your family, and or your caregiver the skills that are needed to administer the IV medication. Among other things, the nurse will teach you how to care for your line, properly take care of the medication and supplies, and discuss any side effects that might be expected. The supplies and equipment used for home infusion, and we will be providing to you, are simpler and easier to use than the equipment you have seen in the hospital. During your course of therapy, you will meet with your nurse regularly. The therapy you are on and the type of IV access determines how often the meetings will occur. Typically, this is once a week during your therapy. During your visits with your nurse, they will change the dressing on your IV, draw any labs that have been ordered by your physician, and evaluate the progress of your therapy. Our pharmacist, your doctor or doctors, and your infusion nurse will all monitor your lab results and overall response to therapy. Our offices are open during regular business hours and our clinical team is available on call or after hours. A local phone number will be provided for your convenience. In addition to the training and education that you will receive firsthand, information on what to expect at home while on service, and other helpful educational information can always be found in your patient packet included in your initial delivery and on our website. www.infusioncare.com. At Home Solutions, we understand that you have a choice of infusion providers, and we appreciate that you have chosen us. Thank you for allowing us to care for you at home, and welcome to our family.